Welcome to our deep dive on the myth of the USMLE-Free Clinical Fellowship for International Medical Graduates. In this video, we will clearly explain why bypassing the USMLE for clinical training in the United States is, in almost all cases, not feasible. We will walk through licensing requirements, the rare non-clinical research exception, and most importantly, the smartest path forward if you want a clinical career in the U.S. Here is our agenda. First, we will define the core barrier to a clinical fellowship in the United States, which is clinical licensure. Next, we will clarify what training licenses typically require. Then, we will explore the rare non-clinical research exception and why pursuing USMLE-free routes can be a poor use of time. After that, we will provide a practical roadmap. Finally, we will reinforce the learning with brief quizzes and a summary. Disclaimer. This video is for educational purposes only and does not constitute legal or licensing advice. Policies and requirements can change and may vary significantly across states, institutions, and visa categories. You must verify current rules with ECFMG, USMLE, and your target state medical board before making career decisions. This myth persists because of anecdotal reports and ambiguous job titles. Many roles called fellowships are actually non-clinical research appointments. Today, we will unpack what counts as clinical training, what licensing requires, and where rare exceptions exist. We will transition from the myth to the real licensing pathway. A clinical fellowship requires direct patient care, prescribing rights, and medical decision-making under supervision. To legally hold such a position, the hospital must sponsor you for a state training license. State boards generally require completion of the USMLE sequence and ECFMG certification to issue this license. Therefore, if you do not complete the USMLE sequence, you cannot obtain ECFMG certification, you cannot get a training license, and you cannot begin a clinical fellowship. In short, no USMLE, no license, no clinical fellowship. We will now visualize this pathway for clarity. This flowchart depicts the full dependency chain. The process starts when an international medical graduate decides to pursue a U.S. clinical fellowship. The hospital must be able to sponsor a training license. The state board then evaluates prerequisites. Those commonly include USMLE, steps 1, 2, and 3, along with ECFMG certification. If these are satisfied, the state issues a training license, and the physician can start the clinical fellowship, delivering supervised patient care. In the alternate path, if USMLE requirements are not met, ECFMG certification is not possible. Consequently, the training license is denied, and a clinical fellowship cannot proceed. On the left is a clinical fellowship, which includes direct patient contact, prescribing, and procedures. It requires a training license, and therefore requires USMLE and ECFMG. It counts toward clinical career development and potentially board-related pathways. On the right is a non-clinical research position, which has no patient contact, no prescribing, and usually does not require a training license. These roles can be T32 or post-doctoral positions and are not ACGME accredited. They do not provide clinical credit toward board certification. This comparison clarifies why the so-called exception is not a clinical training pathway. Searching for USMLE-free clinical fellowships can consume months without yielding results. The U.S. system is designed to ensure that clinical training is anchored to licensing exams. The most strategic use of time for an aspiring clinician is to focus on completing the USMLE sequence and ECFMG certification. That effort opens the door to legitimate clinical opportunities nationwide. Here is a practical roadmap. First, commit to the USMLE pathway and identify target states for future application. Second, create a structured study calendar for steps 1, 2, and 3. Third, organize ECFMG certification requirements early, including documents and applicable communication pathway requirements. Fourth, build your profile through research output, permissible U.S. clinical exposure, and strong recommendations. Fifth, network with programs and mentors at conferences and virtual events. Sixth, apply broadly and on time to ACGME accredited programs. Finally, if you need interim work or experience, Consider non-clinical research roles as a temporary bridge while you complete exams. This table contrasts common myths with facts. Myth: some fellowships waive USMLE for international graduates. Fact: clinical fellowships depend on training licenses that require USMLE and ECFMG. Myth: research fellowships equate to clinical credit. Fact: non-clinical research roles provide no clinical training credit. Myth: USMLE matters only for residency. Fact: USMLE underpins most physician clinical engagement, including fellowships. Myth: searching for exceptions is efficient. Fact: time is better spent completing USMLE and meeting licensure requirements. This timeline shows a structured 18-month plan. Months 0 to 2 are for detailed planning and obtaining resources. Months 3 to 8 focus on Step 1 preparation. Months 6 to 12 overlap Step 2 CK preparation. Months 10 to 14 focus on ECFMG paperwork and the communication pathway. Months 12 to 16 dedicate time for Step 3. Months 14 to 18 correspond to applications and interviews. The overlaps illustrate that tasks can progress in parallel to save time. Quiz time. Question: can you obtain a clinical fellowship in the United States without completing the USMLE exams? Options are: A. yes, some states allow it if you have strong research. B. no, because clinical fellowships require training licenses dependent on USMLE and ECFMG. C. yes, if you secure a T32 grant. D. yes, if you have ECFMG alone without USMLE. You may pause the video now to think about the answer. We will discuss the answer in the next section of the video. The correct answer is no, because clinical fellowships require training licenses dependent on USMLE and ECFMG. Since clinical fellowships involve patient care, they require a state training license, and those licenses depend on completion of USMLE requirements and ECFMG certification. The only pathway that might avoid USMLE entirely is a strictly non-clinical research role, such as a T32 or postdoctoral position. These have no patient contact and therefore typically do not require a training license. They are competitive, and many programs still prefer candidates with ECFMG certification. Most importantly, these roles provide no clinical credit toward board certifications. They may serve as a bridge while you prepare for and complete the USMLE sequence. This sequence diagram contrasts two workflows. In the clinical path, the IMG applies to a clinical fellowship, the institution requests a training license from the state board, and the state board requires USMLE completion and ECFMG certification. After the IMG passes exams and obtains ECFMG certification, the state board issues the training license, and the institution can make a clinical offer. In the research path, the IMG applies to a non-clinical research role, the institution confirms there is no patient contact, and the role proceeds without clinical credit or a training license. Second quiz. Question: which combination is typically required to obtain a state training license for a clinical fellowship? Options are: A. USMLE, Step 1 only. B. USMLE, Steps 1, 2, and 3 plus ECFMG certification. C. ECFMG certification alone. D. A strong publication record and a T32 grant. You may pause the video now to think about the answer. We will discuss the answer in the next section of the video. The correct answer is USMLE, Steps 1, 2, and 3 plus ECFMG certification. Training licenses depend on exam completion and ECFMG certification because clinical fellowships involve direct patient care. Key points. Clinical training requires a state license, which in turn requires USMLE and ECFMG. Non-clinical research is not clinical credit. Avoid spending time on exceptions and instead build eligibility. Invest effort in passing USMLE, which enables real clinical opportunities. Here is a quick Markdown-style checklist to make this actionable. Define your target states and programs. Build a detailed study plan for USMLE Steps 1, 2, and 3. Begin your ECFMG paperwork as early as possible. Seek observerships or other permissible exposure. Increase your research output and build mentorship connections. A practical tip is to track your tasks in a weekly dashboard for accountability. The accompanying mind map summarizes the strategy components: exams, ECFMG, profile building, and applications. In summary, USMLE-free clinical fellowships are not realistic because clinical licensure is tied to exams and ECFMG certification. State boards and hospitals use these requirements to protect patient safety. Non-clinical research roles exist, but do not provide clinical training credit. Your best strategy is to complete the USMLE sequence, secure ECFMG certification, and apply broadly to accredited programs. Thank you for watching. If this video helped clarify your path, please like, share, and subscribe. Tell us in the comments where you are in your journey and what topics you want next.